Before we start today's show, we want to invite you to stick around at the end of the episode to enjoy a preview of a new podcast that premieres on July 14th. As the industry's exclusive cannabis podcast network, MJBulls is proud to present Women Leading in Cannabis. Join host Kira Reed each week for inspirational discussions with women who are leading the cannabis industry. For too many years, families of children with devastating illnesses have felt helpless as they watch their child suffer. Today, they're taking matters into their own hands and finally finding relief treating their child with cannabis. These are their stories.
Welcome to another episode of Love and Cannabis. I am Nina Simmons.
And I am Osiris Stephen.
And we are the proud parents of Aiden Stephen.
Hey guys, welcome to another episode.
Hello.
Oh my God, today's episode is going to be probably one of those that, I've said I've many times before. I'm excited about this, but this one I am definitely excited.
Very excited.
Of her help, support, and nothing but love has helped us move forward with Aiden and helping him get through those bumps and bruises in his development, as well as just finding the right mix of when it came to CBD oil. And so I am very fortunate, as well as our family, very grateful and very fortunate to have Dr. Junella Chin. She's an advocate for better understanding of science and medicine of cannabis. Dr. Chin has an office in New York City and Westchester, and she consults with many doctors and patients in the area of cannabis. And she was our second doctor that we've turned to, and we're not turning back. So, Dr. Chin, welcome.
Thank you so much for having me. I was very, very excited. All day I was looking forward to this podcast, talking with you.
Yay! Oh, my God. We've been excited for about a year, and we're like, why we haven't gotten her on the show yet? I'm like, you know what, for the most part, since we started doing it, we're like, okay, let's get better at it. Let's get better at this. And then we'll bring on board because we don't want to look like some Joe Blows like, really, guys?
And then we finally got the equipment to have guests on because, you can't have anyone in your place now. So
yeah, exactly. So the timing. So we've really stepped up our game to make sure that we have, as you can say, we've cleaned our home to make sure to welcome you in.
Well, thank you.
No problem. So please give us our audience a background on your experience, how you got started, and where are you now with being in this industry and helping families?
Sure. Yeah. Well, I got started in California 15 years ago. California legalized medical cannabis 20 years ago. So,
Wow.
So when I started, that medical model in California was at its infancy. And I was a patient before I even became a physician. So I was diagnosed with an autoimmune disease of my spine when I was a med student. And one of my attendings, one of my mentors, offered me cannabis to help me get out of pain. And he was an HIV and AIDS doctor. And he said, look, you wear this back brace all the time. You got to work 100 hours a week. You're never going to become a doctor unless you get this pain under control. And so he opened my eyes to medical cannabis. It helped me for my chronic pain. So when I started my practice, it was actually mostly special needs children. So my husband and I started our practice in Southern California. And these kids actually were, parents did all the legwork, just like you did all the research, and said, hey, what about cannabis for my son or my daughter with seizure disorder or a metabolic disorder, genetic disorder. Some of them came in non-ambulatory, right? They were in a wheelchair. Some of them came in nonverbal. But they said, hey, this cannabis works for the seizures or the muscle spasm or the pain. My girlfriend told me about it and it helped her and her child. So we opened up our eyes with the help of other parents. And we started integrating cannabis safely as MDs with their other medications. So we worked with other neurologists. We worked with their speech therapists, their physical therapists, their OT as a team, because we always knew that it was a team approach when it came to treating the child and integrating medical cannabis. And so here I am, 15 years later, I'm in New York. I grew up, I'm a Bronx native, so I came back to New York 5 years ago. and I have the practice out here, and we treat children and adults.
Oh,
now.
wow. Because I remember, I think it was just on children you were working with, but now you've moved into the adults, or has that been always?
Yeah, we treat adults, because, the biggest challenge is finding a doctor that will talk to you honestly about cannabis, and finding a doctor that understands prescription medication, right? Regular prescription medication, because there's going to be both in a lot of cases. So we started integrating it for adults because adults could, we're family practice by training, so we neuromuscular medicine and family practice. So both my husband and I, we know how to treat adults and children, so we started making it a family clinic.
Oh, wow, it's interesting. Now, is there a difference in your approach between the adult and the child, or is it something, or are there similarities as you go along until some point you decide to change it up for each one?
It's very different. When you're treating a child, you're, obviously working so closely with the parents and educating the parents, teaching them how to keep a journal, something as simple as keeping a journal. And then you're talking to the other healthcare providers, because you're, for me, standing up for the parent and saying, yes, I agree that medical cannabis is something we should do. Some of those other healthcare providers have a stigma, or they might feel like, you know what, I'm not comfortable with medical cannabis. And so I'm here as a partner with the parents. So then we talk to the other healthcare providers and try and educate them, not to convince them, but just educating them, opening up their eyes to something new. Some of the practitioners, they'll say, you know what, we don't want you in our practice. So then I have to help them find other integrative or holistic practitioners as well. So it's a little more legwork.
Yeah.
And then we're talking to teachers. If medical cannabis works, we're trying to bring in the teachers and the nursing and administrative staff, right? If the child goes to school, filling out paperwork and making sure they can get their medicine in school. So it's easier actually for adults, because adults have a lot more flexibility.
Wow. Just to give a backdrop for basically our listeners, we had met you after our first initial doctor helped us get a medical marijuana card, a gentleman that we met through a friend of mine. He really had no idea. He just knew that he wanted to give out a prescription, and he just wanted to be in the industry. He had no idea what was going to work and what didn't work. But we took his advice, and was able to get the CBD oil that we wanted. We had, I think.
So what I just got the sense. I went to medical cannabis doctor, but I got the sense that he didn't really work with children.
Yeah, that was our biggest issue.
He knew what he was doing, but we got the sense that he never worked with seizures, actually. Not so much children, but like seizures.
Epilepsy, yeah.
Which
was
is
not his
different
thing.
than the adult chronic pain or the post-traumatic stress. And then I went to a Women Grow meeting, and I met one of your colleagues, and he then referred me to you, and that's how we met.
Yeah, that's how the whole thing started. And from then on, you've been a big supporter. In fact, when we had initially did the press conference to introduce the Tunshin bill, the 8191, the S8191 in New York, we had the press conference. You were there. You were to support it. Prior to that lead up, it's funny because I haven't really gotten a chance to talk to anybody who was there to support us. Like, what was happening for you during that time, and then what's happened since then? Because that press conference, to me, it was really huge. And it did get a lot of visibility. And then also the video that we did with the Huffington Post that had over like 4.5 million views.
Yes.
On Facebook. I was like, I met people like in different states that like, you look familiar. Oh, I seen you. I'm like, yeah, we did the Huffington. Oh my God, that was beautiful. I'm like, okay. It's like, yes, that's us.
Yes. I still have other families calling me from watching that video.
Get out.
And this is years later.
Yeah, I know.
It's very different treating children. I mean, and I treat children not just with seizures, but with ADHD, with anxiety. Kids that have Tourette's, OCD. That a lot of things that cannabis work for, but it's challenging, and it's different than an adult practice because we have to be on top of everything with the child. They can't express, oh, I don't feel good, or a seizure's coming on, mama. So you will look at Aiden, and you already know from the look in his eye. He has a glaze in his eye, or he got up a little bit differently,
Yes.
You already feel it in your bones.
Oh, my
right?
God. Yes, we are so in tune.
So exactly. So you'll know more than any X-ray, MRI, CT scan, EEG before it even comes out. You already know what's going to say.
That's true.
So for me as a physician, I believe that working very closely with the parents, because parents know their child better than anyone. So if you tell me that Onfi is not working, something different is happening, then we will have that conversation with the neurologist. Or if you're saying even this cannabis dose, this is too strong or this is not strong enough. So it is a lot of collaboration, a lot of background work that physicians that don't have experience with pediatric cases and integrating medical cannabis just can't do. So for me, I kept a lot of data, medical data, clinical data for my 15 years in California, because I had to cover my butt, number one. I had to make sure that I charted everything. And this is all I had. I only had the parents to tell me what they kept in their journal. I only had, their ancillary health providers tell me, what they saw in PT or OT, and I jotted everything down. I kept every information down, and I started to see patterns. I started to say, wow, this cannabinoid, this profile did this, and at this age, and look what happens when the child reaches puberty. It's a growth spurt. Seizures are going to increase, and this is what we need to do with the cannabis, or even for female patients. For girls that start menstruation. When they start menstruation, a lot of the cannabis regimen has to change too. So all of these things that I've learned over the years, is where I get, the evidence. Where people say there is nothing but anecdotal data, but we've been sitting on data from California for 20 years. Come on now.
Wow.
That's crazy. That is absolutely crazy. So, I mean, just listening to what you're saying, because we actually remember those times when Aiden would get a cold, we'll notice there's a change in his seizure activity. Or when he has growth spurts and the seizures are through the roof, we're like, okay, what's the timeline? Oh, my God, it's about his growth spurt time. And so we have to adjust to the CBD accordingly.
And I think that's the difference between that parents, maybe you could explain to parents a little bit more, is that it's not going to be always consistent.
Yeah.
In terms of the results. There are going to be some dips. There are going to have to be some adjustments. Maybe you can explain that a little bit more with CBD.
Absolutely. It's not going to be consistent because of hormone changes, sleep changes, cold and flu, all of that stuff. I mean, even for adults too. For me as a woman going through perimenopause, I'm like, wow, these are some changes. Adults adults go through these changes too. We don't realize it because we just kind of like try and put it to the background. We're not paying attention to ourselves. But children are very, very sensitive to anything. It could be light. It could be, you watched a late movie and then you didn't get enough sleep. Bam, there you go.
Sleep, yeah.
Oh my God.
Yes,
yeah,
we know the sleep part very, very, very well.
Yeah.
So, I work in a school, and I'm seeing a lot of children with ADHD, ADD. Are you getting more patients with that diagnosis?
Yes, I am. And of course, I help integrate nutrition. It's very important for ADHD kids. But I do integrate medical cannabis as well. It helps, I think with the nervous system. I always say kids with ADHD, they have a Ferrari as a brain, and they have bicycle pedals for brakes. And, that saying is very, very common, and it's true. They just can't stop. And, it could be the humming of the HVAC system, or, the child in front of them is tapping on a pencil, and then the teacher is dangling their keys. So all of that is really important, and they start to glue to that. So what the cannabis does, the cannabis tempers all of that and allows the child to focus. And, we're not talking about giving cannabis to a normal teenager, a normal functioning teenager. When children have this, quality of life disrupted by ADHD, anxiety, OCD, they have a not 100% functioning endocannabinoid system. So they need something.
Got it. So now the patients that you've been seeing, are they referred to or walk-ins? I mean, because I know that when we did everything together with the Huffington Post, with the press conference, have you noticed that you've been getting an increase since then? Or was it basically about the same prior to all the things that we've been doing and that you've been doing on your own?
My family's, everyone knows you guys.
Get out. Really?
I mean, it's really, since we've been working together, they have been like, we want to be like Aiden. And we want to learn whatever you taught, whatever you said to this person. Like, we saw that Huffington Post. We saw,
That's hilarious.
How'd you get the nurse to do this? How did you, give us a map, but no, everyone knows about you guys.
Oh my God. That is. You're going to be meeting people like, I know you guys. I'm like, okay, who am I? And America's Most Wanted.
No, you have changed, I was just thousands of lives.
Wow.
And that's being conservative.
Wow.
And I get emails from all across the country. I mean, so it's not just New York.
Oh, wow.
Yeah, I mean, I get emails from a lot of people from southern states that don't have access to even hemp CBD.
Yeah.
That's sad.
Right? That have seen, the transformation, that know about your podcast, that know about what your story and your journey through with Aiden, and they're following it because they don't have the support. This is sort of their roadmap. And they're trying to figure out ways to get to where you're at.
Wow.
Oh, thank you.
I have to be honest. Watching that video was the Huffington Post was very, very hard.
How long did it take before we actually watched the whole thing?
It took us like about for me.
It took us about a week and a half to 2 weeks from the time, because they were in touch with us, Lena, with the young lady from Huffington Post. She had got it set up. She had posted on Facebook, and then she reached out to me and said, "Hey, look, we're posting this on Facebook." I think we watched within the first 30 seconds. I had to stop.
We had to stop.
And I'm like, I'll watch it another day, because this has been our life real time. And then for it to be played back at us was a lot.
It was heavy for me.
Oh, my God. I think we both kind of cried a little bit to realize, like, wow, this is where we are.
And just to kind of...
Well, I think it's also very brave of you to share your story. When Huffington Post contacted me and Dr. Davinsky about doing a story, they said, do you have any families, with children that would be willing to speak with us? And I gave them a few names, and all of them said no, except for you and Dr. Preparato. Most families don't want to share their story because they're either afraid of the stigma, what their neighbors are going to think, or what their family members are going to think. And then they're afraid of just getting in trouble with Child Protective Services.
Really?
Yeah.
That's interesting. I guess for us, it was like, no, we have to let people know, because somebody's going through this and we don't want them to go through the same thing we went through. I think the benefit for us is that we took a chance within the first 2 months of him being diagnosed, that we said, we're going to do the CBD oil. Because a year prior to that, I just learned about cannabis altogether in the sense of being medicinal. Because before that, I just thought, hey, recreation, get high, just sit somewhere, get something to eat, call it a day.
We really didn't know
just become a stoner. I knew the negative side part of it, as opposed to the positive that it offers.
And what really happened was that we saw that Aiden was going to be into this spiral of medicine, because he was on his second med and he was on the highest dose. Because you know how they just, basically you add on. They don't take any off. So you could be on 2 and then they'll give you another one. So you're on 3 and then they'll max that one out. And we kind of saw that Aiden was going to be in that, that spiral. And we wanted to do this before that happened.
But do you think Nina, also because of your healthcare background, do you think that, preempted you because you already had that foundation? I
do. But, sometimes you separate the two. But what got me was one day I was at the hospital and I saw a patient. Well, he had seizures too, but it was a grown man. He was like 6'4", like over 250. And he was on the same amount of Keppra as Aiden.
Yeah.
And Aiden was 2 years old.
Yeah.
And I said, no,
Yeah. This can't be happening.
I said, because I had to look through his, he's my patient, so I looked through his meds and I knew he had seizure. I said, this no.
Right.
No.
Yeah, and what's crazy, because what benefited us is the fact that at the time I was a stay-at-home dad. So I'm doing research. I'm home doing research. I'm spending time with him. So I'm watching him. And when he was on the Keppra, and I'm like, this guy's losing his mind. And I'm like watching this. I'm watching a 2.5, 3-year-old just lose it. Just wake up in the morning, just start crying for uncontrollably, just for no reason. And I'm like, we're not doing the Keppra anymore. And that's when Nina was saying, well, I had an experience. I saw this. And I'm like, okay, we're done with it. And what was interesting is that the doctor at the time, the neurologist that we were seeing, was one of the top neurologists in New York City. And he prescribed this. And what we found out later on is that the amount that he prescribed was for an adult male that's way over 200 pounds that he had our son on. So, we know, but it comes to the education, because at some point we're just like, for me, I'm not trusting when it comes to like medical professions. This is something, because I feel that everybody has an in for something. So I just have to double check their work in a sense. Like, you know what? You're offering this, I'm going to research it, and then I'll come back to you with a yes or a no. And that was one of the things. Nina, because to her background, because she's in the medical field, she sees the opposite. So it's like, for us, I think it's helped one another really balance things out and understanding, like, okay, what will work and what will not work? What are we comfortable with?
Yeah, I'm trusting, but of course I have to question things, but I'm more trusting than
in the medical
Osiris.
than I am. I'm not. I trust nothing. No one in that sense when it comes to this, especially because as a father, this is my family. As a male role model, I have to protect.
Yeah.
You know, and that's one of the things, especially when you're having a black male child. It's like, I'm like a hypersensitive, big bear. I'm protecting everything. Now, I had this question for you. I've been thinking about it for quite some time. Knowing Aiden and patients that you have who may be similar, are you seeing any differences as you've been seeing with Aiden? Because I sent you the video of Aiden on the scooter, and that hasn't changed. That's been him on the scooter for the past, 3 years now?
As it should be.
Yeah, even longer, yeah.
Yeah, because, I mean, he'll have a seizure. He'll have like a jerk, or what we call a jerk is like a quick twitch that just jolt him, like it looks like he has Tourette's, and he'll go right back to whatever he was doing, especially if he's scooting. Like, do you see patients like that with the recovery?
The recovery is...
The recovery for Aiden, he snaps back a lot faster.
Yes.
Because you started earlier. Because also you guys did everything else. You know, all the therapies, you did nutrition, you talked about, all these other integrative things for him, and you started early. A lot of the families either don't have access, right? So a lot of them don't have access to CBD, to cannabis, or they don't stick with it. They don't, they give up, and then they're sporadic. So then they try it, and then they're off 6 months, and try it again, and then, then they're off. So if there is no consistency, if there is no support, there's no access, that changes the whole game.
It does.
Which is, it's not going to work.
Because his teachers, they're amazed. They're expecting that someone to have to be sleeping the whole day.
Yeah.
Right.
And he hasn't.
He's not.
I've witnessed some things where like I said, take him out on a scooter. He'll have a seizure. He'll completely collapse, and he'll, go into almost like a grand mal, but doesn't last that long. It's 10 seconds. He'll get up, and I'm like, "You okay?" He'll cry for a bit. He's like, "Yeah, I'm okay." I said, "Okay, let's go back." He'll jump on the scooter and just start running. It's just like nothing happened. And then because we noticed, one of the things I noticed with him is that his right leg would be weaker. And so I'll have him alternate and push off on the right leg to strengthen that up. And then I'll tell him alternate, switch on the left. And he does it and recognize it.
Wow.
And we've been recording. I've been documenting this for a while. I have videos since he was about, when we first got his scooter, 4 years old, 4 or 5 years old. He's 7 now. So I'm just wondering, again, with your patients, have you seen that kind of results with them, with the same condition that Aiden's has, when he was about 100, 200 seizures a day, to be able to still?
No, I mean, you're really one of the few, because you are Olympian status. I mean, so not a lot of parents can document and be diligent, or even have the time to be at home, or the healthcare background. So having that healthcare background, I think, makes a big difference. Understanding anatomy and physiology makes a difference.
Yes,
some of the parents, they have a caregiver or a nurse come, and then they're off to work, and then and then that's it.
It's
or
hard.
they're in a school with 15, 20 other kids in the same classroom, and they don't have an aide. So there's a lot of different dynamics that go on with this. So I don't see the same results with everyone. It really does take a village. It takes everyone to be on board.
God. So I remember having a conversation with you, and you were talking about how CBD cannabis provides neuroprotection for brain. Can you explain to listeners a little bit more about that?
Yeah, please.
Yeah, exactly. So it provides this cerebral protection, right? This neuroprotection where it helps, basically him recover from the seizure. So, and this is just, children and adults I see this with. Adults with seizures, when they're taking cannabis, when the kids are taking cannabis and they have a seizure, they recover so much faster. Whereas before, it would take at least 24 to 48 hours. They're in this lull, and you're like, oh, he or she just had a big seizure. Give it a day or two, and then we'll get back to normal. But with the cannabis usage, it just comes back. They just bounce back. Even if you're having nocturnal seizures in the morning, they're just still functional. And it makes a huge difference, especially for children that are still growing, that are still assimilating. So you think of like nutrients and appetite, exercise. So by him recovering faster, he's not losing that time, recovering in school and losing his appetite or just laying in bed, not being stimulated. So you've actually gained time with him in his recovery.
Yes, true. Because I know the early on stages when he first started developing seizures, he would just be out cold, and then the medication would give him what was the Diastat. That's Valium, and he would be out cold. He couldn't do anything.
And we haven't used Diastat. I mean,
oh my God, we haven't
in
years.
We
haven't used Diastat since he was 3.
Yes,
we stopped using it
because he doesn't need it because he doesn't have seizures that last 3 minutes. Or I think it was 3 or 5 minutes that we had to. Yeah. And that's like last year we went to see a neurologist. She's like, "Yeah, you haven't been hospitalized. You haven't."
No, and plus, at this point, I don't think we would go because we know what to do.
And it's like
Yeah, even if he has a flu or something, we know what to do. We have protocols. We've actually integrated protocols if something happens. Like Aiden has a seizure in the middle of the night, because he was having like around 4 o'clock in the morning. He had to grab them all. First thing, one of us is up, gets an ice pack put in the base of his neck. Let him lay there. After 30 seconds, it stops. Then we rub some CBD either on his gums or we'll just rub it on the bottom of his feet. We have this teamwork that we do.
Wow.
That we put into place.
Wow. That is amazing.
You could explain to the listeners more. So we were doing this thing with Aiden in the middle. Say he was having twitches at night.
That jerks.
Jerks at night.
Twitches.
We would give him CBD. It might be TMI for some people, but we were doing it rectally.
Yeah.
We had like a
suppositories
type style. Can you explain? And that would really stop his seizures very quickly. Can you explain to the listeners why that happened?
So you're basically having him, absorb the cannabis mucosally. So basically going in and absorbing it through the rectum as a suppository bypasses, the salivary enzymes through his mouth. If you're having them take a capsule or a tincture that's not sublingual, you have to go through the liver and the digestion and the metabolism. And that, that's the whole reason why they have the Diastat as well, rectally. It's just a quick delivery. Not all children respond that way, unfortunately, but most of them do. Most of them do.
Wow. On average, how much medications are your patients before they come to you? Like, I'm a parent, I come to you, my child is having these issues, the other, practitioners can't help. Can you help me?
Yeah, usually about 4 to 5 meds. Yep,
that's what I
on average, 4 to 5 meds.
Wow.
You have the anti-seizure medication, usually like a benzo, and sometimes an antidepressant, and then sometimes like an constipation medication, right? Because all those medications give you constipation, so they're either on like a stool softener or something like that. They're on a lot of meds, and when you have a little tiny body trying to process those meds, they end up not eating a lot.
Yeah, it's true. That's one of the things we were fortunate that Aiden loves vegetables. He's never eaten baby food. He's never had goobers. He has no idea what that is. Because like I said, I was home, so I made all the meals. I made avocados, pureed avocados, pureed spinach, pureed all the vegetables for him to have. Meat was a tough sell. That took a while. But I think that also benefited him too in the long run, just having vegetables.
Of of course, 100%. But again, not a lot of families even understand nutrition. Yesterday, I was on a call with someone from upstate New York. Same thing. Child, she, about 100 seizures a month, I would say, or more. So it's really, a dozen a day, easily.
Yeah.
And she was a teenager, special needs, no nonverbal, but she was sitting there drinking, Coca-Cola.
Oh.
So the nurse, so they have a nurse that is, with them, and I just see them pouring the Coca-Cola and giving it, and that's, she's just sipping it throughout the day. And I said, is she drinking Coke all day? And they were saying, yeah, can we put the cannabis in? Can we put the oil in with the Coke? I said, oh my goodness, This is going to be a longer session.
Oh my God, I don't think Aiden ever had soda.
But it's very common. It's very, very common.
See, that's another world for us because Aiden hates anything outside of water. We have to force orange juice on him.
Well, I know, but his palate is different. Most kids don't eat vegetables.
Oh, yes, right.
Because the parents don't give them vegetables.
I remember Aiden was screaming in the kitchen once for spinach. He started tearing the kitchen apart. Where's my salad?
He's a foodie. What can I say?
He was breastfed for 2.5 years.
Lucky guy.
See, there you go.
Jesus.
I know it was tough. Have you been getting referrals from other doctors? Like they're sending their patients to you because they seem to not be able to help them?
Yes. Yeah, I still get many referrals because most physicians are not in private practice. They're part of a large conglomerate, a large medical center, and they have to follow the guidelines of the medical center. So if the medical center says our policy is no cannabis, then they'll refer out.
So they can't help them themselves with the cannabis because they can't offer it, so they have to refer out.
Correct. Yeah, they have to follow whatever the board of directors decide for the hospital.
Wow. Now, have you been seeing a lot of resistance or acceptance in your field as it relates to cannabis?
I've been doing this for so long. A lot has changed, but a lot hasn't, unfortunately.
Yes, I feel the same way.
Yeah, and the West Coast is very different from the East Coast. In the West Coast, it's much more open, much more access. Families don't really have to pay for the cannabis. They were sharing it with each other, basically using the bud and making the tinctures themselves. It was very grassroots. And when things started changing and large corporations were taking over and buying up small mom and pops, you started seeing the shift where families are just outpriced. They can't afford cannabis, at the dispensary or in the regulated market because they were growing and making their own. They knew the cultivator and they were making their own. And now it's a real, really polar opposite. Families in New York are spending $3,000 a month at the dispensary.
Wow.
So the cannabis works, right? The cannabis works, but they're just totally. You need so much of it, right? Regularly,
yes.
Especially if you're seizing so much throughout the day, and especially in the beginning, you need a lot in the beginning because you're trying to get through that hump.
Yeah.
And figuring out what works and what doesn't work. So you're buying a lot of products.
Oh yeah.
$3,000 a month, easily. $3,000 a month.
Oh my God.
We were
just on the cannabis.
Wow, we're about $300 to $400 a month, and we're complaining.
Well, I think the reason why is because Aiden is no longer at that stage where he needs a whole lot more than probably other kids where they're going constantly through bottles. Because now, the question to you is nutrition. How much of a percentage does that play in the child's health and development as you deal with cannabis being introduced?
I think it has more of a difference, if not equal.
Yes.
Okay.
But not everyone can do a ketogenic paleo type diet, and sometimes it doesn't work. But not everyone has the access to having good foods either, unfortunately.
Yeah, it's true.
Yeah, I work with a lot of underserved communities, and because parents are at work or they just don't have access to the freshest produce, they just can't do it.
That makes a lot of sense.
Yeah, and it requires so much too to go shopping, because I think at some point when Aiden was initially diagnosed, I think within like 6 months, we would go food shopping, and I literally cleared out my cabinet, threw anything that was processed, anything that hasn't been used in 2-3 months, and threw it out and started from scratch and basically read every label, monitored everything, and it was become like to the point that this is our focus. Like, make sure we have the right meals, the right amount of vegetables and fruits in the house.
Absolutely. I mean, you think about, most of those processed foods, it's high fructose corn syrup, right? So it's just all sugar. It's or canola oil, just laden with canola oil. So there really is no nutritional substance in it. And these are developing kids. And even, like Nina, with your ADHD kids, ask them what they're eating at home.
Oh, no.
Right?
I know one of my kids had a Cinnabon. And I'm like, oh, no.
Yeah. I know. If I had a Cinnabon, I would not be able to sit still either.
Right. Be bouncing off the walls.
Yeah. But it's hard. Again, parents are working and the kids refuse flat out.
It's a quick fix. Like, look, I got to do this. I got to get out of here. Here. All right, take it. Cinnamon bun.
Exactly. If the kids are refusing and they have a meltdown,
and you have to get to school, you have to work. Like, you can't,
Right.
You can't wrestle with a kid.
Exactly. So it's not to say that that's an excuse, but there's a lot of dynamics that we really need help working with. So I actually have a lot of families. I find them like a nutritionist that is in network. So either through their hospital, I know Montefiore has nutritionists and special nutritionists. So there's nutritionists for irritable bowel and Crohn's disease. So they focus just on that, celiac disease or things like that. There's a nutritionist just for seizure patients. So nutritionists have branched off on their own specialty, and they help the families and they coach the families on how to, bring in the foods slowly, and then everyone on the family has to be on board.
Yes.
So the parents can't cheat and buy, the ice cream and things for themselves, and then their children are eating something different. The whole family has to make a change.
Yes, family lifestyle.
Exactly. Are you finding certain foods kind of complement the CBD?
Oh, mangoes, I heard, does.
I have not found that.
Okay.
I know there's certain oils, the essential oils that are called penetration enhancers, and they do help with the plant terpenes itself. If you can preserve the plant terpenes, it helps absorption with the oils, and that's with many nutritional supplements, not just cannabis. But foods in general, I've heard of that, like mango having myrcene and helping with the absorption, but I have not really been able to see anything solid on that.
I thought chocolate was another
clinically
one.
speaking.
No, I don't know.
Yeah, chocolate or foods with fats, that helps with the absorption.
Yes.
Because cannabis is fat soluble. But it just for working with children, it's like whatever it takes to get it in.
Yeah, right. So what's your opinion about CBD water? With where they state it has a high bioavailability. Do you think there's really something solid to that, especially in water when we're saying that the body the fat is so absorbed through the oil?
Oh, in terms of like encapsulation with nanotechnology and making it more water soluble?
Yeah, between the two.
Yeah, I get asked that all the time.
Mm-hmm.
Yes.
And I have not seen any like clinical data where they test the pharmacokinetics, like the absorption, and if it's any better. But I know that plant medicine, especially cannabis, is fat soluble for a reason. So, if we're trying to mess with it and trying to make it water soluble, is that, crossing that lipid barrier, is that really good? I don't know.
That makes sense.
That's a good question.
I'm not sure. So the jury's still out. I'd like to wait and see what happens.
Yeah, because I know a number of companies that are doing it. I mean, if I've had the CBD water and I've felt the difference.
Okay.
It was about 10 milligrams. I was like, whoa.
All right.
But it was about $7 a bottle. It
Oh,
was like
my
maybe
goodness.
a liter bottle. I'm like, Lord, I don't know how that's going to fly off the shelf. Now, with your patients, how do you also integrate the other fields? So I think that was something you talked about, because you did say that you do work with dietitians and nutritionists. How about physical therapists? Because, again, Nina's background being in physical therapy, mine just being basically a gym nut, just going to work out, that we've been able to integrate exercises for Aiden. Recently, I have him starting to do squats because we noticed that he was walking on his toes a lot. And I knew that was, with Nina sharing with me that is dealing with neurological. So we've been working on his squats, his stance, and dealing with that. Also, just the basic strengthening up his legs. Now, do you work in conjunction with a physical therapist to help parents in understanding their child's, physical limits because of the seizures?
Yes, there's a lot of PTs that specialize in special needs children, So I do work with them, and I make sure actually that the cannabis dosage coincides with their sessions.
Oh, can you explain more about that?
So sometimes kids that are very spastic that can't control muscle tone, so I'll have them use the cannabis right before their PT session, so that everything is relaxed and that the PT can do more work. And a lot of times they'll find that, wow, we actually got more done because the muscles were more relaxed.
Yeah, because the muscles did. Yeah, that was one of Aiden's things. He had like the tight Achilles heel, the tight hamstrings, and calf muscles.
From walking on his toes. My question: there's a lot of topicals out there. Do you think that works better for the spasticity, or is orally?
The topicals are good again if they have penetration enhancers. So if they have essential oils that help go through the epidermal layer. But for the most part, I've seen topicals work really well with neurological issues like a diabetic, foot or nerve pain. I'd say that the menthol bothers children. They're very sensitive already as it is to clothe certain clothing, certain like pressure as well. So anything mentholated, I find that my pediatric patients don't do well with.
Oh, that's interesting. Now, the children that you see, what are like the most glaring issues, physical, that you see outside of the seizures themselves? Is it that either with the wheelchair bound or they limp to one side? Because I noticed that there's times when Aiden will have a seizure and his right side would go weak, like he can't lift his right arm or his right leg drags a bit. Is that something that is common that you see?
Yes.
Yes, it's usually one-sided. It's usually one-sided, and that's the same side. The face will droop on that side, or the neck. The neck muscles collapse, and they'll have a little bit like a torticollis. The spasm of the neck muscle and tilt to one side, and it's usually favoring one side. That is correct. And usually when you look, so Nina, you would know this when you're looking at posture. The scapula, the shoulder blade will be lower. You notice that the hip and the ribs will become more contracted. So what I actually do is I show parents how to just do soft tissue at home. So if they can't get to PT, what kind of massages they can do at home to lengthen that area and just basically work that weak-sided area more. Just massage. And the kids usually end up loving it and fall asleep. But that helps a lot.
Wow. Well, what's the youngest patients that you've seen experiencing spasms and using CBD?
Not a 9-month-old is probably one of the youngest ones I have now active.
Wow, I thought Aiden was young. Wow,
9 months.
Yeah, and they have the seizures. But it when you have them that little, it doesn't look good. It can be a very grim prognosis, unfortunately.
And what are the usually the condition, or do they come in with a certain diagnosis like something they were born with, something that happened during birth, or like is it something environmental that triggered these seizures, or maybe even a cold, a virus?
Yeah, they don't know. They always do. The wonderful thing about like Mount Sinai Epilepsy Center, NYU Langone, they stay on top of all the genetic testing. Once you go into that system, Western medicine, allopathic medicine can be wonderful because they have all these resources to try and research and get down to why this happened. Mm-hmm. And you should utilize them for that. But what they fall short is all they have is the same prescription medications for everyone. And especially with seizure meds.
One size fits all.
Yeah. It's like you can't go back to the Keppra and the Onfi and circle around back. There's only so much you can do with that.
Yeah.
So that's where the things like cannabis works, diet, ancillary health practitioners, all of that is really, really important.
Now, what have you been up to? And did you start writing a book, or have you had another book? Or how are you promoting yourself more?
Well, yeah. Well, last summer I wrote a book. It's a very holistic intro book on, basically what you should know about the history of cannabis and CBD, how we got here, what type of patients I see. If anyone that I would say Cannabis 101, it's a really good book because it'll teach you about plant medicine. What does it mean to start integrating something alternative? How to talk to your doctor about it. We were offered a second book deal, actually, on women's health and cannabis, but COVID hit, and so they canceled the book.
Canceled?
Yeah, the publishers were slashing their staff.
Oh, it's so
in
hard.
March. Yeah.
Oh, I'm very interested in women's health and cannabis. Is it mental health or physical?
Or is it all around?
It's it's interesting because over the years, as I've been treating the children, moms are, and I'm not to say that dads are, don't get the
don't forget the dads.
Okay, but a lot of the moms forget about themselves and they give everything.
I agree.
And so sometimes I'll look at the mom and I'll say, hey, why don't you stay back and why don't we chat? I treat adults, how can I help you? And then they're like, their whole eyes lit up and they're like, me? What?
Yeah, who's that? Why does that happen?
In 10 years.
Yeah, basically.
Yeah, but why does that happen? Because through experience of my own, I've seen it. So I'm just wondering, at what mode do you go I am Han Solo. I'm going to do everything. I have to do everything. I can't sleep. I just got to think about this one child and that's it. Or this children, whatever the case may be, and just focusing on that to the point is a fixation. And they forget they actually exist. Because I think, Nina, you can agree with what I've said to you.
Absolutely.
If you don't take care of yourself, you can't take care of the family.
But it's very hard as women to do that.
It is hard, and a lot of it is like PTSD. So I actually have a colleague that I talk to a lot of. Dr. Holland is one of them, Julie Holland, and a few other psychiatrists. And, there's a tremendous PTSD from day one that you go through. And that's part of it. Being a soldier, so you're just pushing and pushing. And just being almost superhuman, right? Thinking I'm going to figure it out. I'm Mama Bear. It's my responsibility.
Yeah.
And I'm going to figure it out at all costs. And, not a lot of, marriages can withstand that, mentally, physically. And it is very hard. And we always forget, for me as a mother, we forget about our own health. I don't know how we learn to do that.
I think it's innate.
What happened?
And I'm really glad you brought that up because I do feel I'm seeking therapy as well. Now, I do definitely think I do suffer from a form of post-traumatic stress. Just the trauma of seeing your son go through all of this. Mm-hmm. It's very traumatic, and I know a lot of my good friends have kids on the autism spectrum, and that's traumatic too. With the very severe behaviors, where your kids banging their heads or having severe meltdowns. Going through that, it's also traumatic, and you don't think of it as being traumatic at the time, but then when you take a step back, you're like, wow, we've been through a lot.
Yeah, I have a mom who she's almost 70, and her child is almost 30, and he's special needs, doesn't speak, but she has to lock her bedroom door, because he's self-injurious behavior. Sometimes he'll act out on mom, but she has to lock her bedroom door because she's afraid he'll come in and he can hurt her.
Yeah,
that is scary at 70. So what happens? That's one of the topics in my mind that I'm looking at, big picture, is down the road when that child becomes an adult and the parent is no longer able to take care of not even them, but themselves, where they need to be in a nursing home or a hospice. What happens to this adult?
Exactly.
See, that's what we're concerned about, son.
There are not enough places for these. I mean, so her option was to put him in a group home. And when she tried putting him in a group home, they would just sedate him all day long.
Yeah, because they don't have the manpower to deal with an individual that age, that size. It's just
right,
because they usually turn to be what triggers them in a hormone that some of these children grow up to be these man-sized adults. Wow, you're 6'2", 240.
Yeah,
it's and then you have this behavioral issue.
Yeah.
I sense that there's going to be the return of the asylums. My personal opinion. I think there's going to be a return for that because the numbers are growing.
Yeah, there's got to be something. Even if there's an extension of nursing homes they have for elderly, if they can have better extended care homes or respite homes where they can take them for a little bit and give the parents some respite. And I think it's very complicated. A lot of parents will say, well, what happened if I get old or if I die? If something happens to me, who's going to take care of my special need child or a special need adult?
Yeah, that's a big question. Now, what are the states doing in reference to that? I mean, they're good for throwing money at things, but nothing with any real substance or any real life changing. It just says, hey, okay, this is what you need. Here's the money. Good luck. I mean, are you seeing anything?
It's so tough. No, because and every state is different depending on funding. So with COVID, right, for example, the last 3-4 months, I have been so busy with families calling me because they're not working, or they have to work from home, or they have a special need child. So they don't even get a break. They can't even go to work and get a break, what they normally do. So they are going crazy. The whole family is going crazy, and they're worried about getting sick. They can't go outside to take a walk. I had a 2-year-old that what kept him from his meltdowns, this autistic child, is going to the playground every day.
Exercising.
Going to the playground, being active, exercising. And they couldn't do that. And the child would stay up till 4 a.m. So finally, the only thing she gave him, and continuously gives him to this day, is the iPad. So now he's so addicted to the iPad, and he can't get off. He can't get off. And so, she's calling me in a craze, like, he has insomnia, I have insomnia, there's behavior issues, his motor tics are getting worse. So it's this whole spiral that, and it's like, wow, how the cannabis is not going to fix that.
I was very sad. I work with severe special needs children, and I was very sad for the parents when we had to leave school. Very, very sad. Because the routine.
Yes. These kids in these conditions need routines.
The routine is off.
Especially boys.
Exactly.
So I could imagine them asking for help for something,
Anything. So the lifeline. The question for you. Are you also collecting, because I know New York State's not great for this. I don't want to badmouth them, but they're terrible when it comes to aggregated numbers on the age, sex, and location of children under the medical marijuana program. The patients that you see, especially when they're around children, do you have data on the demographics, age, as well as sex, so you get an idea who your patients are, basically?
Yeah, so I'm seeing a lot of pediatric patients, but also young adults that have, that basically can't give consent. Okay. So I treat them as special needs, quote unquote children, because the parents are the health proxies.
Okay. Now, what are the ages like? You see a large number under the 5 years old, or in between the 10 to 12?
Oh my goodness, it really varies. I mean, I see toddlers, all the way up to 30 years old, who is a nonverbal special needs. So there's a mix of all of them. Since we've been together working on the Huffington Post piece, and some of the advocacy that you've done, it's a real spike in younger children, because they've seen your video, they've been inspired, they want to look at what a roadmap would look like for them. So under the age of 10, easily.
Wow, that's a big number. It's a big spike.
Mm-hmm.
And most of it is the seizures and neurological disorders, or do you see a spike in the seizure aspect of it, like epilepsy, or do you see in the ADHD or ADD? Which one has skyrocketed since you've been seeing?
A lot of seizure patients, but also I do see a lot of OCD patients.
OCD.
So pediatric patients that have motor tics or OCD tendencies. It's a really big thing that the cannabis works for. Unfortunately, OCD is not a qualifying condition here in New York.
Yeah.
But a lot of the special needs children have concurrent diseases like irritable bowel, which we can qualify under irritable bowel, or some sort of a neurological disease, and then we treat for the different symptoms like the OCD or the motor tics or the Tourette's.
Now so you're seeing a number of children and adults with stomach issues, as well as on top of the, let's say, the ADHD or the seizure activities.
Yes.
Are there is there a correlation between the two?
Yes, there is. So when you have it's the gut and the brain axis is very interrelated. So you are very meticulous about Aiden's diet, so you probably see a lot less of it. But a lot of parents will notice, the kids either has tremendous constipation, so they're on stool softener, they're on Metamucil. I mean, they have all this, excess stuff, or they have diarrhea and they're just having the runs all day.
Oh, my
and
God.
Then on top of that, the seizures or ADHD or OCD.
Oh my God. Now, what was the most severe case you've seen on either end when it came to the gut health?
I've had a kid with what's called short bowel syndrome, where he was born with, abnormal bowel. Basically, the intestines were shortened. Some of it was not developed properly and had to be surgically removed. And he just doesn't assimilate his nutrients, and he has seizures. So that's been really, really hard to put weight on him, control the seizure, and to help with behavior as well.
I know that parent's going through it. Sadly, that some time ago, Nina and I were doing some research, and I came across something which was really scary and fascinating at the same time, where 50% of divorces, 90 out of 50% of the divorces that happen nationwide, 90% of them has to deal with a child with a disability in the home. And I found that staggering. That it was mind-boggling. I'm like, 90% are due to with a child in a home that has a disability. So it's like parents have reached, one parent says, I can't do this anymore, and just basically walks away.
Well, it's interesting that you say that, because now that I'm thinking about it, I've never looked up that statistic. A lot of the special needs families that I deal with, either it's a single mom or the mom and dad are not together, and I usually have to do 2 separate visits. So the mom comes in, all gung-ho, I want to learn about cannabis, blah, blah, blah. And then they're like, okay, well, you got to speak to my ex-husband separately and just tell him what you told me.
Wow.
And then we got to get him on board, or, her partner may not be a male or female, get her on board, and then it's a longer process.
Oh,
so that's interesting you brought that up. I didn't even put those together.
Yeah, because Nina and I, we
had our challenges.
Challenges? That's an understatement. We just didn't have enough furniture. But because it can burn you out. I think for us, it was the uncertainty and then the lack of sleep, because Aiden sleeps with me. So, to make sure that, if he's okay, if he happens to have a grandma in the middle of the night, somebody's up and, being able to jump on it. And I think that was a part of it. It's just that we lacked the sleep. And at the same time, it's just that uncertainty of like, okay, how long is it before he heals, completely? Or, when is it going to stop? Because we're always looking for the end game. This put an end to this, as opposed to getting through the process and making sure he's healthy, that eventually his body will break it and he'll be fine.
Yeah, so we definitely know how that is with the relationship, and that's kind of why we started this podcast.
Yeah,
really.
wants to communicate that, and I think a lot of it too is also we didn't know how to communicate with each other when it came to Aiden, because she Nina has her perspective and I have mine, and it would come down to, well, whose perspective is going to win. And it's like, okay, it got to the point where we had to, if we had a case to make about let's change his diet, well, why? And it's like, well, because I want to. No, it's not good enough. So
bring the data.
Yeah, bring the data.
The research.
So we both have our paper research right here in front of us. Sit down at the table. Let me see your research. What do you have? What do you have? And we just exchanged the document. But I think that made us better, really, because then we got it really, really involved and in depth in doing research and finding ways to help them.
Wow, that's amazing. What a blessing. Really, I know it must be really hard. I can't imagine. But, you guys have really done so much, not only for Aiden, but for other families. I hope you realize that.
It's funny you say that. I'm like, really? Granted, there's been a couple of families that we've reached out to us, that we shared some information, guided them, and they were very appreciative. So, it's just like, I wish there was someone there for us family-wise when we were going through it. But, just the fact that we got involved in the community, and it's such a small community. The cannabis community is so small that they were able to refer us to people, and we just, one thing led to another, and that's how we met you, and that's how we met some other people as well in the industry that have been able to help us, even provide us samples of stuff that for us to try out. It's been great. I have nothing negative to say. I had a last question. When it comes down to CBD and the ingredients, one of the things that we learned was that sunflower and lecithin oil tends to trigger Aiden seizures. Why?
Oh my goodness, we talked about that, Nina, huh?
Yes, and that's why he wanted to bring it up, because
I needed to explain to me.
I noticed that on my own. when I started looking at the ingredients. Because what I do with the clinical data that I collect is, every quarter, every 3 months, we start to extrapolate it. I work with a biostatistician. So otherwise, I'm staring at charts upon charts upon charts. But I look at all the data, and then we start looking for basically trends. So I have everything down from the blood test to what they're taking, and then the ingredients of their cannabis oil. And I noticed that the sunflower and lecithin started triggering the seizures when it's in a cumulative amount on certain kids, more so on boys. And I contacted one of my nurse friends who's a cannabis nurse, and she's an expert in nutrition. And I asked her that, and she said, "Oh my God, I noticed that too."
Wow, hello.
I know. I mean, and this is what the cannabis industry is, right? So we're sharing each other's data because that's all we have, right? We can't research it and put into a clinical trial because of its federal regulations still. So we all come together, and I can't figure out the pharmacokinetics, why that would be the case. I looked ever since we talked about it, I think it's like a year and a half ago. I can't find anything on it. And I was going to ask my colleague, Dr. Spellman. He's a PhD in plant. He's a plant chemist, essentially. And I keep forgetting to ask him. But now that it's on my mind, I'm going to ask him and get back to you with the answer.
Yeah, it's very interesting because he was on this company. It was fine. It was working really great, actually. Then all of a sudden, it was
seizures were just jumping,
and then it was different, like shakiness. His teacher even mentioned it, and I just happened to look, and I'm like, wait, this additive wasn't there.
Well, what benefited us is the fact that we kept the old bottles.
Yeah, we kept the old bottles.
Don't ask why. Don't ask why we kept the old bottles. But ironically, we kept the old bottles, and Nina's looking at and comparing the ingredients, and she said, "Hold on, the legend's included, and it's not in the old one. So the old batch, even so, if you look at the COAs, the certificate of analysis." The lab reports, it didn't match up with what we're used to having. So they kind of changed things and didn't really give us a heads up.
Yeah. So so we were when CBD companies who are just starting off, we kind of say just keep it simple, like food.
Yeah.
Two basic ingredients.
And that's it. Don't go crazy. Don't cut corners, because it's gonna kill you in the end.
Because a lot of people try to add.
Yeah. To make it more, I guess, bioavailable, or just make it more
I would
fancy.
I would Aiden just keep it simple. The carrier oil, CBD. That's it.
That's all the two you need.
Because sometimes you don't know how the child's going to react to what other additives are put in.
Yeah, but have you seen anything with the sunflower specifically? Because sunflower is in everything.
It is, unfortunately, and so then you have to think about. For me, I think my background's in biochemistry and in nutrition, so it's what are the metabolites that lead, because it's not just the lecithin, it's what your body is metabolizing it and converting it to. So what is that conversion and how is that affecting him neurologically? So that's what you have to look at, the metabolic steps. Lecithin is found in egg yolk too. So then you think about, because when you first told me, I thought, well, is he allergic to eggs? Is he allergic to, does he have that effect on red meat? Because a lot of people that are allergic to lecithin, egg yolk, red meat is usually kind of in the same grouping. So it's pretty complicated.
It is. You would have to strip down to the beginning.
Because I know Aiden has a high metabolism, and I think we discussed that maybe it was just having the CBD go right through him, and he wasn't absorbing it.
Yeah. Well, they say he only absorbs like 8 to 10% anyway, if that.
But maybe he wasn't getting the CBD absorbing. Like maybe it was causing him to metabolize the CBD too quickly. I don't know.
Yeah, that's why I always say to my parents, your child better than I do. So when they say something to me, like you said, something's up with this, I never poo-poo it. I never put it aside. I'm always like, really? Okay, let me write this down. Let me look at the chart. Let's go back and, to the drawing board. Let's review everything. And a lot of doctors don't have time to do that. They're like, no, that's nothing. No, it's not that. And then that's it. And you're like, what? That's the end of the story? Okay, we're not going to talk about this no more? Like, what?
That's true. So let me. This question is: what do you see as the most important, or even what do you have charted for parents when it comes to water, food, and rest?
The biggest thing for epilepsy that is like the lowest hanging fruit is the sleeping.
Yes, we noticed that too.
Yeah.
Okay, so diet is very hard, right? Diet's hard. That's why I have a nutritionist, like a coach, essentially helping the family, right? If you get good sleep, for an epileptic patient, adults or child, it sets the tone for the rest of the day.
Oh, yes, it does.
It does.
And
So
teachers would
that is
text me.
yes, that's the number one thing. And then also it sets the tone for even learning. So when we sleep, when Aiden is sleeping, he's assimilating what's happened throughout the whole day. He's sort of reconciling that in his brain. He's filing things away that he's learned. This is non-REM and REM sleep. His hormones change during sleep. The gut flora changes, like we talked about, the intermittent fasting and how our gut flora changes with circadian rhythm. So same thing with a child. When they're sleeping regular hours and get a good night's sleep, it makes such a difference on seizure patients, more than anything.
Yes, and
hydration, because we noticed that when he has not had enough water, he'll have twitches. He'll just have like constant twitches, like nonstop, or he'll have what the other thing is the jerks. And the urine, when he does go to the bathroom, the urine is so strong. It's like you could smell the medication coming through it.
Ah, okay.
So,
how do you get him to drink water?
A cup, or
just a cup, or we use a syringe. Just pump him up. I usually like to offer him a piece of fruit or something in exchange, like, hey, drink the water and I give you a toy or I give you something. Let's make a deal.
Some firm talking.
Well, yes, I don't want to say that because I don't know if CPS is listening.
but he's getting older now, so we said, do you want to have seizures? Like we
can talk to him into it now.
Yeah.
Okay,
we can say,
good.
do you want to have seizures? No. Okay, drink your water. And he knows about being healthy.
Yeah.
We used to say, we do want to be healthy? Yes. Okay, healthy people drink water, a lot of it.
Yeah. That's one of the things to do. One of many things that we've been doing with him is also encouraging him to speak, because when he first started having those massive seizures in the beginning, Bunch was 2.5 years old, when he was just starting to use his words, and he stopped, and I was teaching him sign language. Now he's able to start to use his words on his own, and it's just like the clarity is starting to come through.
Nice.
Now, are you also integrating things like that? Because I know that one of the other things that were with children with muscle tone weakness, their jaw muscles are weak, their tongue, they're not able to pronounce certain words or things like that.
So I work with what's called a myofunctional therapist. And they help, and you can even Google it. The exercises are online. It's called Myofunctional Therapy, and that helps. There's different exercises you can do for the mouth, using a tongue depressor, moving the tongue back and forth, tying a string to a button, and having having the button in the lip, and having him close the lip while you tug on the string. That teaches him to have purse his lips essentially, and strengthen the muscles there. That helps with speech. And then sometimes kids will have what's called an appliance. So, it might be like, it's not braces, but it's a mouth appliance that slips in. And it'll either widen the palate, help with swallowing, help with bruxism, like clenching of the jaw. So when I said it takes a village, I really mean it. So I refer to certain dentists that deal with special needs children.
Wow.
Yeah.
Say the name again. You said a biofunctionist, you said?
Myofunctional therapy. Mm-hmm.
Myofunctional, I've heard of it. It's interesting because I saw a product on Instagram. It's called Jawsize, like jaw. And basically it's a ball. It's a rubber ball. You heat it up in hot water, and then you just bite down, you clench down, and what it is supposed to do is chew on it. It's just a ball that you kind of chew on, and it strengthens the muscles around the jawline.
Well, what I actually recommend is something called a Myo Munchie, MYO, and then Munchie is MUNCHEE. It's a chewing device, but it's not a ball, so it's the shape of a mouth, and then it has a thing that you can tug on. And basically the child puts it into their mouth, and then they tug on it on their own. So you read a book. You say, okay, we're going to read a book together. You put in the Myo Munchie, and the kid starts to pull on it. So it brings the jaw forward into a right alignment. So look it up.
Yeah, we have it.
It's better than just chewing on a ball, because you're looking at forward growth and not just vertical growth.
Interesting. Okay.
I know. We got to do another podcast.
Yes, we do.
On this.
Yes, we do.
All right.
And that's my thought too. Is the next podcast we're going to do is how to help the child outside of CBD, the exercises, the
There you
therapies.
go.
Like you think, is
Perfect.
everything.
Yeah, it's not just one thing. But oh my God, this has been awesome. I could do this for another hour. because we got a lot of catching up to do, but we're not going to.
I think your listeners. I don't think your listeners.
Oh yeah,
would
they
appreciate
die
that.
out. People die out.
Well, and again, those who are in need and just have no clue, this is a great episode. So, props to them for staying tuned in. Dr. Chen, thank you again for your time. Really appreciate you. Love you like family, and for everything you've done for us. I mean, wholeheartedly, and I've been waiting to tell you this. Thank you very much.
Thank you.
Oh, it's been my pleasure. And you can find my information at drjunechin.com.
Yes.
And when you look at it, you'll see Aiden. Aiden's right out there in front, and I have this whole little...
Yeah, I see
I know,
him.
we see it.
Oh, my God.
He looks so much different now.
Yeah, if you see him now, you wouldn't recognize him.
Oh, he's so itty bitty.
Oh, yeah, he was bitty. Now he's like, I'm playing middle linebacker.
Oh, that's awesome. Well, when things get better, we should definitely see each other in person.
Definitely, yes.
I would love and look forward to it. I know that the CWC is still having their show this year, so I'll keep you posted as well. Hopefully, I'll see you on some webinar.
And you're doing telehealth, right? Right now, virtual only?
Yeah.
Yep, I'm doing telehealth.
Oh, great.
CWC, I think I'm speaking in October, actually, in women's health.
Awesome.
Yep.
So,
Yep.
now you're
All right.
So you have any live casts that you're doing, or the webinars? Are you posting any on your website?
Yes, I'm posting it on my website and my Instagram page.
Oh, awesome.
Gotcha.
We'll definitely look forward to seeing that. We'll stay in touch, and definitely looking forward to seeing you again. And we'll bring Aiden. You're just not going to recognize him. He's so different.
Oh, I love it.
All right.
Sounds good.
Thank you, Ian.
All right, have a good summer.
You too.
Okay.
Thank you.
Thank you. Bye-bye.
Bye-bye.
Thanks for tuning in another episode of
Love and Cannabis.
I'm Osiris Stephen.
And I'm Nina Simmons.
Be strong.
And stay empowered.
Tell me, boy, you make me so bored. You need to walk the other way. I tell you once more. Please get out of my way. I don't want you no more. We're done here, boy. I know you think you're so fine, but you can't see it. I've been wanting to unwind.
Hi, my name is Kira Reed, and I'd like to invite you to be inspired by the women who are leading in the cannabis industry. Each week, we will discuss empowerment, leadership, and what it means to be a woman in charge in marijuana, hemp, and CBD. As the founder of the Women Empowered in Cannabis community, I have had the great pleasure to get to know many brilliant and talented women who are CEOs, executives, politicians, advocates, and community leaders that are focused on creating a cannabis economy that is just, fair, and equal. We'll learn how these women make decisions, how they navigate a predominantly male industry, and what they're doing to level the playing field for women. I hope you'll join us.